we had pretty good data with the old strains of the coronavirus that if you were vaccinated, you were far less likely to transmit the virus. That's probably still true. There probably is a higher chance that you can transmit this Delta virus than some of the old strains because there's just more of this virus.
We're going in the wrong direction. If you look at the inflection of the curve of new cases, it is among the unvaccinated. And since we have 50% of the country is not fully vaccinated, that's a problem.
The highly contagious Delta variant of COVID-19 is driving a dangerous new wave of the pandemic across the country. COVID-19 cases are spiking across the U.S., with the 7-day average of new cases rising more than 160%. And the Delta variant now makes up more than 80% of all new cases. We are bringing in an expert from the front lines right now. Dr. Devi is a physician from New York. She's also running to be the city's public advocate. Dr. Devi, thank you for joining us. You have a beautiful last name, but I am 100% certain that there's not enough time in this show for me to get it right. So would you allow me to call you Dr. Devi?
Sure, that's fine. Thank you. Thanks for having me.
Yes, ma'am. Thank you for being with us. What, in your judgment, are the biggest myths or misconceptions about the COVID vaccine?
So, well, with the vaccine, first of all, I think that the vaccine is worth getting. So I do encourage people to get it. But on the other hand, my problem with the way that this is going is that I think that people are getting stigmatized a lot, and that is actually the worst management strategy in this case. So, for example, people who are unvaccinated are being blamed for the spread of the Delta variant, right? But if we look at all viruses and their natural evolution, there's a survival of the fittest. So what viruses want to do is the same thing that we want to do, that they want to survive. So it's natural for them to want to become more contagious. But we don't know this yet. But generally, what viruses want to do is become less deadly, because if they become more deadly, what they'll do is they will kill the host, and then they won't survive either. So you have to look at several different measures at the same time, not necessarily just new cases, but also hospitalizations and also deaths. And you can't look at hospitalizations alone, because we have had almost a year that people haven't been able to get regular medical care or as good medical care in terms of, let's say, cancer or heart disease as they would have in the past. So, for example, I can say I myself, before there was a vaccine, I was hospitalized and I had COVID at the same time, but I was hospitalized because I was in labor. I was giving birth. So I would have gone down as a COVID hospitalization, but I wasn't hospitalized for that reason. So we have to look, when we see these inflection points, why are people being hospitalized? Is it because they have COVID, or is it because they need other medical care and they are coming in and they're testing positive for the Delta variant? Now, you might have a more contagious variant, but we also have to look at the testing itself. We have highly sensitive testing, which is the good thing. We have incredible technology. But we also have a situation, just think about in general, we have bacteria, we have all kinds of pathogens that are on our skin, in our body, in our gut. We carry all kinds of things on us. I have a toddler, she's a petri dish, right? So we can have all these pathogens on us. Doesn't necessarily mean that we're infected. So, for example, we had the Olympics recently where people who were vaccinated, fully vaccinated with no symptoms, were being tested with a highly sensitive test. So are they infected, or are they just what we call colonized, simply carrying this virus on them? We really need to tease out those things. So I think from a management point of view, there are a lot of questions that still need to be answered before we can say that we are in the midst of such a dangerous situation. And instead of encouraging people who might be sick to come forward and get treatment with monoclonal antibodies, with remdesivir, which is fully FDA approved and could actually save lives, we're stigmatizing people and maybe making them afraid to come forward to the healthcare system, maybe making them stay away where they could potentially die from the virus and potentially spread the virus, instead of encouraging to come forward for life-saving treatment that could help them.
Doctor, one place that I have never felt stigmatized was in my doctor's office. So assume that I was not vaccinated, but I went to you because I trust you. You're not a lawyer. You're not on Facebook. You're a doctor. So I go to you. What is the best argument for me, even now, if I'm not vaccinated, to get vaccinated? Or what would your advice be?
Well, so I tell patients, so I separate things out in terms of immediate effects, short-term effects, and then long-term effects. And then I separated it out in terms of benefits and risks. So we know for COVID that if you catch the virus, sure, some people are okay, but a lot of people are not. And we know that death is potentially an immediate, risk from the virus, that you could die from it. So in terms of the vaccine, if you compare it, well, sometimes people have some pain immediately in the arm at the injection site. We know sometimes they might have some type of, fever, like short-term sort of effects, but generally it's pretty safe. So the argument against the vaccine is that people say, oh, well, I don't know the long-term effects. Well, we don't know the long-term effects of COVID either. I mean, at this point, I'm sort of seeing some people with some chest pain syndrome, some neurologic effects, some psychiatric effects, if they make it that far, right? So if you weigh all those things against each other in terms of what we know, there's a strong, strong argument to get the vaccine, especially if you have any risk factors, any cardiovascular risk factors, obesity, if you're older age, if you're around anyone who's sick. So the evidence seems to be in favor of that. I wish that, again, in terms of management, our government would just go through the full FDA authorization process so we could go through that informed consent process. But at least from the data that we have now, it is in favor of the vaccine. I will say, my field is pain management. So I do different operative procedures for the spine for people with cancer, people with all kinds of problems. I recommend my procedures. I'm still in favor of informed consent. So I still go through that process. So you can still have both and be in favor of both.
Well, all I'm trying to get people to do is go to actual medical doctors to have this conversation, as opposed to a lawyer like me or a florist. Nothing against florists, but I like getting medical advice from doctors. And I am grateful that you came on and shared your counsel with people. Thank you very much.
Thank you.